On the National Health Insurance Bill, it has now been approved by Parliament, but critics say if implemented, the NHI will see a complete shutdown of the private healthcare sector. NHI seeks to improve access to medical services for all South Africans. But what plans are there to ensure the survival of the multi-billion rand medical aid industry? We speak now to Discovery Health CEO, Dr. Ryan Noach, who talks to us from Johannesburg. Dr. Noach, thank you for your time. Let's begin with your comment on this sentiment that if the NHI does indeed become law in South Africa, it will decimate the private healthcare sector. Where do you stand on that?
Good morning, Polly, and thanks very much for having me on the show. That sounds like a panicky reaction, and to be quite clear, we're not in a panicked state about this. In the first instance, there's a long way to go before there's any impact whatsoever on medical schemes, and for that matter, we think on the private healthcare system, even in the event that the NHI bill is promulgated in its current form. Let me explain why. The NHI bill in Section 33 talks about full implementation of the NHI before any impact on medical schemes. And in the Department of Health's own terminology, from the time that the Act is promulgated, their view is that it would be 10 to 15 years prior to being able to fully implement the NHI. Our view as administrators of medical insurance plans, like an NHI would purport to be, and we do it for about 4 million people. The NHI's ambition is to do it for the whole country, about 60 million people. It takes huge sophistication and many, many years to get right. And so there's a long time before implementation is a reality. And so at this stage, there's no need for panic.
There's no need for panic. That then assumes that there are thoroughgoing conversations between the public and private healthcare sector. If so, if the assumption is correct, do you know at this stage how the NHI is going to be funded? Because that's one of the big questions.
Yeah, it's probably the biggest question, and you're spot on in raising that. And the truth is that nobody knows the answer to that. The money bill, which is the complementary financing legislation and regulation from the National Treasury, is nowhere to be seen. It's not been published. And in fact, the Minister of Finance in his budget speech in February this year made very little reference to the NHI, safe to say that the work from the Treasury side on the financing of the NHI was nascent and had not advanced at this point in time. So without that money bill, we don't know how it will be financed. There are broad financing references in the current draft bill, which talk to taxes that every South African would have to pay to contribute towards the NHI. And in their commentary, the Department of Health refers to the fact that the private sector and the public sector combined currently contribute about 8.5% of GDP towards the cost of healthcare. And they assume, and I should add quite naively, they assume that this 8.5% would just be redirected into a national health insurance scheme. But quite clearly, that's obviously not how it could work. And there would need to be an act and regulations to support how it would be financed.
Well, I sense a bit of trepidation there. Are you worried that the public healthcare sector will and could encroach into the funds that are right now propping up the private healthcare sector?
No, I'm not worried about that at all, Polly, and for good reason. Those funds are contributed by members of the medical schemes from their after-tax earnings, and they're contributed voluntarily, and they're well protected by the medical schemes, which are effectively trust funds. They're functioning as mutuals, and they hold those funds on behalf of the members. And by law, there's no ways that anybody could take or nationalize access to those funds. That would be completely beyond the realm of realistic thought. It would be like taking people's pension money and nationalizing them. If the money belongs to those people who contributed it from the after-tax income. Yeah. So we see no mechanism to do that whatsoever, and we think it's well protected by law.
While we're on the subject of funding the NHI, Dr. Noach, there is this assumption in the bill which says a single NHI fund managed by the state will buy healthcare services from both the public and private sectors free to the public at a point of delivery. Make that make sense to us, the lay people. What exactly does that mean?
Well, the intention and the aspiration of the fund is that there is a single fund, one insurance fund, a pooled risk, which would purchase all healthcare on behalf of all South Africans. The scale of this would be unparalleled, because what the Act purports to, or aspires to, is to do this as a monopolistic funder. In other words, absolutely excluding any other funders. We can't find another country in the world that manages to do this. If you look at the United Kingdom, which probably has one of the most successful national healthcare systems across the world. Although that said, I should caveat even the NHS in the UK is going through meaningful challenges at the moment.
Yeah.
But there, even in the United Kingdom, 12% of the population chooses to purchase private medical insurance. So as you go country to country and you look at nationalized health systems, none of them that we can find exclude by law the participation of private insurance and private funders. So the Act aspires to create the single fund, which will probably be, nobody knows yet, but probably be in the order of, call it 500 billion to 700 billion a year, using the estimates that are in the market today. The Department of Health's own representatives have referred to a number of 550 billion. That's an annual spend of the fund.
Sure.
So over 10 years, this fund would be spending somewhere between 5 and 7 trillion rand. And they aspire to do this through a single fund, dispersing monies to about 100,000 different healthcare providers, if again you make an assumption that the healthcare market remains as it is today, and it really wouldn't. We would unfortunately lose a lot of capability in the healthcare market.
How so? Can I quickly latch on to that? When you say the healthcare sector in South Africa would lose much of its capabilities, I'm assuming here you're talking about a brain drain where medical experts will leave this country. Is that what you're referring to?
In the short term, we believe that that's actually the biggest risk of this bill. We're not worried about the sustainability of schemes at the moment, but in the short term, the biggest risk is the very negative sentiment that's emerging in the healthcare professional grouping. Unfortunately, those working in the public sector are battling with a poorly managed public system. And that's not a matter of opinion. That's fact, and it's been demonstrated, I think, repeatedly through some terrible stories that we're seeing. And those working in the private sector are feeling very, very concerned about this health policy direction. And we think there's a real short to medium term risk to healthcare professionals. We are seeing early signs of that. We're doing all we can to calm the health professionals, partner them and work with them and reassure them, because we do believe that the outcome here could be optimistic, and we are quite favorably disposed to a NHI, and I should talk about what that looks like. But the doctors are really very concerned, together with many other healthcare professionals.
Sure. You've already made reference to Section 33 of this bill. I want to explore that further, because what it says there is that once the national health insurance has been fully implemented as determined by the minister, medical schemes, i.e. Discovery, may only offer complementary cover to services not reimbursable by the fund. Explain that again in simple language.
Yeah, in simple language, what that means is when the minister determines that the NHI has been fully implemented, And there's no definition in the Act of what fully implemented means. But we're assuming it means that the benefit pathways, the contracting is complete, and all South Africans have free access to healthcare funded by the NHI. At that point in time, the Minister will limit the coverage that medical schemes can offer to only those services which the NHI doesn't fund. So in the bill, the NHI sets out to cover certain benefit packages. Those haven't yet been determined. We've never seen what those benefit packages look like. But effectively, those benefit packages would be covered by the NHI, and anything outside of those benefit packages, only that, exclusively that, could be covered by medical schemes. We don't know what's in and what's out because that hasn't yet been determined.
And then there is another distressing point here, Dr. Noach. The health minister making an admission that while there is no rush to rolling out the NHI, because we have been told that it is going to be implemented in phases, he says that government first needs 200 billion rand to fix hospitals. This is Dr. Patla admitting as much. You've already made reference to healthcare practitioners in the public healthcare sector who are under severe pressure, and you've also alluded to them leaving. What does this tell you about the state of healthcare in the public sector, and if such amounts are needed to just fix the infrastructure first? How many years is it going to take for this to be implemented?
Goli, I don't have the answers, but let me say quite clearly that I applaud and commend the National Minister of Health for his honesty and his frankness. I think that the priority that he's expressing is exactly right. And, it's fantastic to hear a leader and a politician being absolutely clear about what the priority should be. I must say that were I in his position, and I clearly don't have the ability to do that, but were I to be, that priority is clearly the first priority. Let's invest in health system improvement, and let's fix service delivery, because there is a deep concern at the moment about the quality of service delivery. Let me add one further comment, Polly, which is to say that here at Discovery, we really do believe in a national health insurance system. We think that health policy reform is critically important, and in fact it should take the form of simultaneous regulatory change in both the private sector and the public sector to establish a collaborative environment. In our view, it should be a multi-funded environment. In other words, on that Section 33 that you raised, rather than a monopolistic single funder trying to be everything to everyone, should be a multi-funded environment. And we've demonstrated through our actuarial work, which we presented to the Parliamentary Portfolio Committee, we've demonstrated that actually from a fiscal point of view, this would probably be better for all South Africans because of differences in utilization between socio-economic groupings in the country. So we're in favor of an NHI. One shouldn't receive what I'm saying as being against an NHI, not at all.
Yeah.
Actually, there's many elements of this act that are smart, that are feasible and implementable. The part that we're concerned about is that this seeks to be the exclusive single funder and create a pot of money which would, by the way, be the single largest fund in the country by some distance, way bigger than an ESCOM, for example. And we think that that is filled with inherent risk for the country.
As I conclude this conversation, Dr. Noach, I mean, you've made it clear what the risks are to NHI, although you are fully in support of it. But there is also the sentiment that medical schemes are not exactly as affordable nowadays. With the rising cost of living, it is becoming more and more difficult for people to maintain their medical aid schemes. Are you seeing a trend, perhaps, as we talk about the unmanageable cost of living? Are you seeing a trend where people are dropping their medical aid schemes?
Yeah, this is a very important question and really poorly understood. So I'm going to give you an important answer here, and thanks for asking this question. Firstly, on the affordability, You're quite correct, Polly. Medical schemes are extremely expensive. And in fact, the entry level of cover for a medical scheme in South Africa, on average, largely, and there are lots of nuances in this, is about 1,000 rand a month. Think of it as about 1,000 rand a month. The reason it's so expensive is because the Medical Schemes Act, which was drafted in an egalitarian manner, really stipulates about 300 conditions called prescribed minimum benefits, which have to be funded in full by medical schemes from risk funds. And in order to meet the legislative requirements of what schemes must fund by law, the starting price of cover in South Africa for those services is about 1,000 rand. So in the first instance, the medical schemes industry has been campaigning since 2007, Polly. So that's 15 years now, for what's called low-cost benefit options, or some provision in the legislation that allows the schemes to provide lower-cost options. They will obviously not be as comprehensive, but there should be different offerings at different income levels.
Yeah.
And we're delighted that the Council for Medical Schemes has finalized a framework, which it circulated by way of a circular late last year, and has communicated its intent this very month to put on the Minister of Health desk a proposal for legislative amendment to approve these low-cost benefit options.
All right.
And they would come in at a price point of around 300 or to 450 rand a month.
Okay.
It remains to be seen. But so that would change affordability. Sorry, let me quickly answer the second part of your question, which was, do we see people leaving medical schemes at the moment? Decisively, the answer is no. And in fact, in the last 2 years, Discovery Health Medical Scheme has seen its best growth period that it's seen in 10 years.
Wow.
And the scheme has grown over the last 2 years.
That is fantastic news. Dr. Ryan Noach, let me thank you very much for your time and indeed your insight, the Discovery Health CEO.